wanted to know for MRI lumbar spine without, correct?
Yes.
All right, so the self-pay price that they can pay on and then pay on monthly is $1,791, or they can do a self-pay discount price of $209.05, but that does have to be paid the day of the scan.
Wait, 209?
$209.05.
Oh, that's really, really good. And so all they have to do
Yes,
to get
ma'am.
that is just pay it up front.
Yes, ma'am, the 209.05.
Welcome to the Common Sense Show. And today I'm unpacking the healthcare business, the health insurance business. Is healthcare insurance actually driving up your premium? I've been kind of on this discovery for a bit, and I've been just, I don't intentionally always and seek out these things that I talk about on the show, but I thought it was actually interesting to bear in mind what health care insurance premiums versus cash costs could actually pay. It started with me exploring or coming across the timeline of business owners on X, and then it kind of grew from there. I know that for myself, I've been a business owner for over 20 years, and so most of the algorithm of what's shown to me on X is related to business. And so I remember I think like maybe last week or the week before, I came across an account on X that was talking about how this person has joined a health share program, which I'll talk about in a little bit later, and how that has essentially flattened the cost of, healthcare, generally speaking, for this person and his family across the board. So today, what I'm going to do is I'm actually going to share with you some interesting tidbits about the business of healthcare, why I think healthcare costs, actually, I'm just going to stick to the facts, why healthcare costs are exorbitant, what you can do perhaps in your situation to help lower the cost. This is not professional recommended advice. I am not a medical doctor. However, I am a business owner who has had to look at all of this stuff for over 2 decades, and I have common sense, which is the namesake of this podcast. And so I may not I might not be able to get everything. Some of this advice may not apply to you. You may be in a situation where you can't specifically go out and do some of the things that we're talking about in the podcast today. For instance, you may not be able to pay in cash for some of the procedures that we're talking about today. You may not be in a position to do that. You may not be in a position to actually, undertake a payment plan through a hospital. However, there are options out there, and I think that's better for you in the business of life, generally speaking, and the effort to take control of finances, that we all think about how we can lower our costs, and we should pursue the opportunity to lower costs wherever possible. So even if it doesn't fit our specific situation, you should at least inquire about it so that you know what your options are and what you're paying for. So we're going to unpack kind of hitting pricing. We're going to take a look at some more videos from medical professionals who are starting in this process of calling around and seeing how they can get cheaper prices and how you might be able to do it yourself. But first, let's address the business of healthcare. I want to talk about the list prices that healthcare providers actually put up as rates at the hospital. So these are called charge master rates for services when they're being billed through insurance. All right. The reason why the prices for these list rates are so high is because there are so many different buckets and procedures and processes they have to go through to get paid through the health insurance companies, that all of that requires administrative firepower. All right. So there's complex negotiations, there's administrative burdens, potential payment delays, there's denials of the insurance process, and all of these make health insurance claims actually way more expensive. So sometimes when we're paying our health insurance and we're seeing these prices, I just went to the ER because I broke my leg, I had a hard time breathing, I was feeling anxiety, whatever the case is. You go to the ER, you see the bill come in the mail, and the bill's like depending on who you are, $500, $600, $700, $1,000 for an ER visit, for what seemed like just a quick, maybe you had an MRI, maybe you had a quick procedure done, maybe you just saw the doctor, maybe they gave you a little bit of medication, they told you to go see your primary care physician, whatever the case. The reality is that whenever your insurance gets involved, you're involving a whole cadre of people to help manage your specific care. So in contrast, cash paying patients can bypass all of those layers of insurance bureaucracy, and at times can get discounts between 50 to 80% of what it costs to actually go to the hospital and get procedures done. And in some cases, even in advanced procedures that you think are out of reach when it comes to your ability to actually pay, might actually fall into a budget or a payment plan that you could actually afford if you just ask for the cash price. So if you're watching this video and you have a comment, I just want to remind you, feel free to comment in the comment section. If you're watching this on X, go ahead and unfortunately, we can't see live comments during this stream from X, but I will comment on your comment if you post your comment below the video. I'd love to hear from you. So sometimes hospital systems will offer you a steep cash payment for an upfront payment, like the day of, or they'll put you on a payment plan for a cash price instead of wanting to deal with healthcare. Because number one, they're not guaranteed to get the entire price of what they bill healthcare. Healthcare is usually trying to beat them down to get a discount anyway. And number three, billing health insurance can cause delays across the board, and a medical facility may not get. They may treat you today. They may not get that money for 3, 4, 5 months later because they're fighting with health insurance. And sometimes medical facilities don't get that money at all. So for the sake of that aggravation of not seeing any money, they would prefer to negotiate a better rate with the person who's coming in. That's you. So this particular dynamic between the individual, yourself, and the healthcare facility might be able to be managed a little bit better than we thought and more cheaply if we cut out the middleman, which is the insurance company. Now, I do understand that right now healthcare cost and being insured is it's a hot topic, a bugaboo issue. I'm not taking sides of an issue. What I'm telling you is, just factually speaking, cold hard facts, you might be able to get for yourself procedures, medication, insurance. It's not insurance, but procedures, medication, treatment, a little bit cheaper if you pursue another avenue. Now, I've seen discussions online between people saying, oh, well, how can I get insurance? How can I get a better price if I'm already insured, right? And we just naturally assume when our insurance company is actually billing the hospital or charging us that we're getting the absolute lowest rate. There's some comfort in the fact that we believe that the rate is the lowest, that this stuff has been thought about, and we kind of switch off of our analytical brain. Here's my appeal to you. Don't do that, especially if you're under 65, right? You may have a young family. You may be single. Perhaps it's just you and your spouse, right? Think about the fact that you might actually have the opportunity to pay less out-of-pocket costs for some of medical procedures or treatments. And what you could do with that money that is not otherwise going to insurance, but that you can then spend on perhaps savings or investment when a different kind of emergency comes up. We're going to drill down deeply into what the options are and what you might be able to expect when you do this. So I want to just kind of go through the administrative costs, right? Because here's what I did. I asked Grok, right, the XAI, about the administrative costs that are incurred in the healthcare system. And here's what Grok said, because I wanted to get like the framework of a breakdown. So we hear people say, perhaps in Congress when they're running for office, or people in the hospital, when they're describing to you the billing costs, administrative costs. But really, what is comprised of administrative cost? What does that actually mean? Let's talk about this, right? So it says in the U.S. Here's what XAI Agrok said. So in the U.S. healthcare system, administrative costs refer to the non-clinical expenses involved in managing billing, insurance interactions, and related paperwork, which significantly inflate the overall price of services when processed through health insurance compared to direct cash payments. So I don't know how much it costs to process paperwork, but apparently it costs a whole lot, right? And you may be paying for the delta between, what it actually costs to deliver the service to you and how much it costs to staple and fax or email or scan all those charts. It says that these costs arise from the complex interplay between providers like hospitals and doctors, insurers, and sometimes government programs, creating layers of bureaucracy that cash transactions largely avoid. It says a major component in billing and coding where providers must accurately assign standardized codes such as CPT or ICD codes to every procedure, diagnosis, and service to submit claims to insurers. So from my experience, one of the things, I used to be in the health and fitness field for a while. I work with physical therapists, I work with chiropractors, and sometimes what would happen is not sometimes, but when they would bill insurance, they had these ICD codes, right? And the ICD codes essentially tell the insurance company what category of treatment, injury, medication, whatever the case is that they're billing to the insurance company, right? So people who are what's called healthcare coders understand the language of these codes and what they refer to, and they're the ones who pass this information on to the insurer. All right, let's continue. It says this process alone requires specialized staff, software, and training, and errors can lead to claim denials or delays. So if you've ever been sick in the middle of the day and you're like on your couch, sneezing your head off, feeling like you have malaise, you probably saw a commercial for medical coding and billing, where you can get trained, certified, or whatever the credential is to become a medical coding or billing professional. Okay. And so the problem is that even with software and trained staff, that errors can occur. And when errors occur, that can lead to denials of your claim, which means that you have to go back and try to resubmit under something that is accurate to what actually occurred, the service, treatment, or medicine they provided you. Or it means that it could delay because the treatment and perhaps the medicine doesn't align with each other. And so they have to reconcile those differences. And, that could lead to delays. It says physicians' practices spend an estimated $70 billion with a B annually on these activities. Think about that. Just getting the code to the insurance company, just the code, cost $70 billion estimated a year, contributing to the broader $471 billion in total billing and insurance-related cost across the system. And that was as of 2012. Now, I'm sure that somewhere, and maybe I just didn't find it when I was doing research for the show, you can find these figures that are adjusted for 2025, and I'm sure that price is probably higher. But the fact that even 13 years ago, it was at 70 billion just spent on these activities is kind of wild. And I know that there's AI and there's, better technology, but you still need a human to interact with the software or the coding system to input what is going on, right? You don't just walk into a hospital and something scans you like T1000 from the Terminator, determines what you need, and then it sends that code to the insurance company. There's a human element that's in between it. So no doubt in 2025, there are still inordinate and absurd amount of costs associated with delivering this healthcare. So the research continues. It says that another key driver is insurance administrative overhead, including verifying patient coverage and obtaining prior authorizations for treatments and negotiating reimbursement rates. Insurers themselves dedicate about 30% of their spending to administrative functions like claims processing and profit margins, which get passed on indirectly through higher premiums and provider charges. Imagine 30% of the time that they spend and the cost that they spend is on getting paid. Think about this. You work 40 hours a week, right? 30% of 40 hours is 12. Okay. Let's say that you spent 12 hours a week on getting paid for what you did in the other, 28 hours that you were able to work. How inefficient would your business be? 30% of the time on just getting paid is absolutely wild. And you know who's paying for it? We are. The individuals who pay health insurance, right? So that cost gets passed on to us as well. So think about this. If you just eliminate the process of the healthcare company trying to get paid, you've already reduced your cost by 30%. So if a procedure is $1,000, you've already reduced that cost to $700 without paying whatever the healthcare cost is, the administrative costs. And of course, healthcare premiums go up every year. Why? Because I'm assuming it's just like car insurance. I don't know exactly how it works, but I'm sure there's some formula there. Look, my car insurance went up, and I was told that the reason why my car insurance was going up was because people in the area that I live in have been getting into more accidents. People. So not me, but people driving their cars recklessly in my area are causing my insurance rates to go up. That's sick. You got to be sick in the head to be okay with that. Anyways, I continue. For providers dealing with multiple insurers, means handling varied rules, forms, and payment timelines. Hospitals now see administrative expenses exceeding 40% of their total cost, often due to burdensome policies from commercial insurers. Can you believe that? Let's do the math again. Administrative expenses exceeding 40%. Okay. It's time for business talk, right? Now, healthcare delivery is a business. It just is. It's obviously a business, or should be a business with a conscience, because they want to heal people, make people well, and you can dispute about that among yourself. Here's the problem. In business, if your costs go up 10%, what do you do to your service or product that you're delivering? You have to increase your cost by 10%. In this case, to get paid, not only could they deliver a service, a medical service to someone, right? Think about this. But after the insurance company goes through, and let's say that there's an error. Let's say that the original service cost, I don't know, we'll stick with $1,000, easy math. And because the insurance company is already going to beat them down on rates, and the healthcare facility knows that, what are you going to do? If you know they're going to beat you down 40% for rates, right? And so your cost of delivering a service is $1,000 or whatever the case is. And you know they're going to beat you down on average by 30%. You are going to make the cost of what you're delivering, you're going to make up that 30% on the other end. You're going to charge $1,300 so that when that 30% comes off, you get the actual cash that is associated with delivering of the service, right? That's how it happens. So this is how insurance premiums, in my opinion, just from common sense, start to climb. Grok continues. Claim denials, appeals, and collections add further costs. Insurers deny about 15 to 20% of claims initially, requiring providers to resubmit or appeal, which involves legal reviews, additional documentation, and sometimes extended payment delays of 30 to 90 days or more. This contrasts sharply with cash payments where funds are received immediately without these hurdles. Isn't that crazy? They deny between 15 to 20% of claims initially, which means automatically the hospital has to have a legal department. I mean, of course they should anyway, but to specifically handle insurance claims, they have to have a legal department. Are you getting a lawyer for $20 an hour? It doesn't matter if you're in the middle of the country, on the coast, down south, or north near the Canadian border. The lawyers cost cash. And so these hospital systems are hiring lawyers to be able to get these payments to them, and it's delaying their payments 30 to 90 days, thus increasing the cost of delivery. So the medical facilities are adding all these costs up, right? Think about that. The cost of administration to deal with the administrative headache of going through insurance, the cost of a potential denial and the lack of ability to recover, or having a delayed payment while still having to operate and treat other people at the same time with more cash outlays. So what would be a fractionally costing service now costs probably at least 6, 7, 8 times more because insurance is involved. It's wild, isn't it? Absolutely crazy. Okay, each insurance claim transaction averages $12 to $19 in processing costs across payers and providers, multiplying across billions of annual claims. So there's billions of annual claims. The average insurance claim transaction averages $12 to $19. So you do the math. How many billions of dollars is that? How many hundreds of billions probably is that, right? It says overall, these factors contribute to an estimated $496 billion or more per updated analysis. An annual BIR cost. BIR is the administrative cost, representing wasteful spending that drives up list prices for insured services to offset the inefficiencies. That came from AmericanProgress.org. Sorry, turn off my heat. It's getting hot in here. And not just because of the cash. Cash payers sidestep this entirely. No coding, no appeal, no insurer negotiations, allowing providers to offer discounts of 50 to 80% off the inflated rates. So that's 50 to 80% off the inflated rates, bringing it down to the cost of what it would cost just to deliver the service. So this explains why cash prices for the same service can be dramatically lower, often even below when insurers negotiate after all that administrative friction that they go through. So here's what I want to do. I want to take a moment and I want to show you in real life through some social proof, like how doctors are handling and what they're doing to check in on these costs, right? So the administrative bloat in healthcare due to just processing these claims are one thing. Another thing is how, so what does this look like in reality? Okay, so stay tuned. Right, I'm gonna share my screen right now, and I want you to take a look to see what it is costing to deliver these services. Okay, we want to watch this together. I set up a few of these videos.
I'm being accused of being irresponsible by telling people to go uninsured. And I never said I want people to go uninsured. I'm saying that insurance has become unaffordable and a scam, and it allows bad behavior in healthcare. This commenter, which I appreciate, said, like, it's unaffordable compared to what? Swallowing $1,000 payment versus 6K or 7K. Y'all know I tell stories here all the time. And this is particularly about my insured patients. So one of my insured patients in my practice, she has to get quarterly blood work for her lupus condition. When she uses her insurance to get this blood work, it is $500 each time. We're now ordering the same panel from my office without using insurance for $70. So who's really one cheating the system here? I had a patient that needed an echocardiogram for her heart. Using her insurance, $2,000. I sent her to my cardiac doctor. He did it for $350. My last patient needed to get a blood clot ruled out, so she went to the emergency department. She felt like she had no place else to go. After going to the ER to get this blood clot ruled out in her leg, she spent over $3,000. And had she seen me in my practice, I could have sent her to my vascular doctor next door, and he would have done it for only $300 or $400. So we're all overpaying, but we don't know that we're overpaying because the prices are so hidden in healthcare. And so this is why I'm having this conversation. And it's hard. It's hard being kind of shot at saying I'm being irresponsible, because I feel like I'm trying to help people understand that we're being played for fools by thinking that, oh, prices are super high, which is why we need insurance. We need to keep holding on to this insurance for our care, but that's not necessarily true. We keep allowing people to hide prices from them and make them exorbitant, but when you get it out of the way, you'll discover that healthcare is actually much more affordable.
Isn't that crazy? So in her example, right, I laid out for you in detail how the administrative costs scaffold up to this exorbitant, crazy cost that cost people so much money. The problem is the lack of transparency. Imagine taking your car to a mechanic, right? And you know that the issue is that the reason why your car is overheating is that the radiator is leaking fluid. So instead of telling you when you go into the mechanic how much it's going to cost to deliver, to fix your problem, they just fix it. And then at the end, they tell you it's $10,000. And now the actual cost of the radiator is something like, let's say, $250. And it was 2 hours of their time to do it. But the paperwork in between is what cost the $8,500. That's what people are getting charged for. You saw the difference that she said. This is a doctor who sees patients all the time, who's talking about specifically how she's been able to help her patients understand lowering the cost. Now, she said explicitly that she's not talking about people going uninsured, right? In some cases, for some conditions, that is obviously something that, needs to be looked at, right? But I think broadly speaking, and I think what she's getting to, what I've been talking about in this video so far, is that we all need to take a little bit of more of a common sense approach. Here's the reason why. It's because sometimes I think that what happens is we don't personalize things to us, even when they're happening to us, because they feel like they're too big. So for instance, we don't feel like we can, quote, take on the insurance companies, right? But I can assure you, just like the insurance companies are thinking, it's a business. They do all the math, all the calculations to figure out how much they should charge you. Here's the thing. As individuals who participate, we should also have a ruthless view of how we're going to actually pay, or what we're going to do with our own money, with our own budget, right? So we should take a scalpel to things in our life that can cost us many thousands of dollars more. It's about engaging a little bit more, perhaps, than we normally would. It's about looking at opportunities to lower cost. If you've never considered the fact that your health insurance is exorbitant, because not absorbent like a paper towel, exorbitant is exorbitant, right? And without thinking that, oh, you know what, I can lower this cost, then you're probably not going to do it. And that's why this video exists. because I want you to start thinking this way. My podcast is not just about business. It's about business, yes, business owners, but it's also about your personal business and capturing and taking control of operating your life like a business as well. I want you to be able to get the best for yourself. Here's how to do it. You ask questions, you see what's real, and you see what's actually happening, and then you figure out a solution and try to see how you can frame a solution. All right, let's take a look at some more examples of this with another doctor who is on the case. Let me this was part of what the opening video that you saw when you first started watching this. This is the full video about getting an MRI, right? So I want you to take a listen to this. This doctor is calling around getting cash prices on MRIs. Now, before I share this, remember this, that when you get services through your insurance company, the more insurance, the more procedures, medications, the more you engage with the health system, and the more you call upon the insurance companies to pay on your behalf to try to get like procedures that you rightfully need, right? Every time you do that, it's costing the insurance company money, and they're going to want to charge you more. So in business, as you know, usually, except for insurance, the more a customer engages with a business, typically the less it costs them, right? Because in business, we reward loyalty. We want a person coming back over and over and over again. Loyalty is rewarded. In healthcare, it's the opposite, right? So the more and more and more you engage, the more expensive it is to actually engage. Your loyalty, in this case, you're not choosing loyalty because you're sick, right? But the more you engage with the service, the higher the price is. And in normal operating business, it's the opposite way. So even the framing of how the economics of this is kind of crazy as well. So let's take a look at what this doctor has to say about these MRIs. I think you're going to be, I hope you're as interested in this as I am, because this is super fascinating. So one second.
I was calling to get a quote for an MRI scan for a patient who's self-pay.
Okay.
MRI lumbar spine without contrast.
Self-pay total is $729.96, and then we collect half up front.
Do y'all do a discounted rate if they pay the full amount the day of service?
We don't, no ma'am.
Okay.
Originally $1,869.45, but with a self-pay discount, they'd only pay $373.89.
Do they need to pay that amount up front, or could they put that on a payment plan?
So it kind of depends on the patient. If they have a lot of debt here, then we would probably ask for at least half up front.
You said MRI of the L-spine without contrast?
Yes.
Okay. It'll be $1,248.75, but we have our discount. Let me see how much that'll be. The total after the discount would be $433.32.
So that's the self-pay discount?
Yes, that's with self-pay discount. I just know whenever we do like the private pay, we already we go ahead and add that discount to it. So all you would owe is that $433.32.
I understand you need an estimate.
Yes, please.
Do you know, does the patient have any kind of insurance?
No, they're self-pay.
So after the self-pay discount, they're looking at around $1,067.22. She said that that's just the way it is on there. I don't know if the price has changed or what. I do know that in the past I've seen them for less than that, so I'm not quite sure.
And it's a true self-pay patient. They don't have any insurance.
Right, and they can pay in full up front for the discount.
So each of our facilities have a different price list. Charges $38.11 after discount $1,067.
You wanted to know for MRI lumbar spine without, correct?
Yes.
Right, so the self-pay price that they can pay on and then pay on monthly is $1,791, or they can do a self-pay discount price of $209.05, but that does have to be paid the day of the scan.
Wait, 209?
$209.05.
Oh, that's really, really good. And so all they have to do to get that is just pay it up front.
Yes, ma'am, the 209.05.
Dr. Hendry.
It's crazy, right? So this is what I'm talking about. So a couple of examples. So what she was doing when she was calling around to different health facilities to see, right? Here's a question for you. If you were getting someone to do renovations in your home, painting, drywall, I own a construction company, so I'm always going to start with painting and drywall. Painting, drywall, landscaping, electrical, plumbing, roofing. What's the first thing you would do? Let's break it down, right? The first thing you would do is you would get 3 or 4 quotes. Why do you get 3 or 4 quotes? Such that you can compare what you're getting to see which one has, you don't necessarily want the cheapest price, but if there's something that is specific that you want done that can be done for cheaper, you don't necessarily want to pay the most expensive. Now, there may be reasons why you pay the cheapest price for some things, and there may be reasons why you pay the most expensive price for other things. But for services like an MRI, that's just going to go to your doctor for them to read it and to establish what's going on, the image that you need taken. Without contrast, when she called these facilities, do you see the discount in price? Here's one. Yes, we can talk about the last one, right? Because that last price is wild. But I want you to understand the difference between this one. There was one option that she got for MRI with no contrast for $3,811 was the price before discount. $3,811. That is the price that your insurance company would be billed for an MRI without contrast. $3,811. The discount on that price, $3,811, do you remember? It was $1,067. And they were willing to finance the $1,067.22. So let's say that $3,811 turned into about 5 payments of $200-something bucks over the course of like 5 months. Direct cash, straight from the consumer, the patient, you, to the hospital. The hospital would much rather deal with you directly and charge you directly because they're going to get cash to pay for your service than go through insurance. So they already know that they have to bill your insurance over almost $4,000 for $1,000 in 67.22 cents. And do you remember what the gentleman said who was on the phone? Even the discount going from $3,811 to $1,067.22, he said that he remembers seeing it less than that. That's out of control crazy. But let's talk about that final price. When she called and got yet another price for the MRI with contrast, it was $209.55. $209.05. $209.05 for something that one of the hospitals were billing at almost $4,000. Now imagine this particular year, you get 2 MRIs, right? And if you're watching this, and if you're enjoying this so far, make sure you like this video. If you're watching on X, I need you to go click on the link, come to my YouTube channel, subscribe, and like and share. But let's get back to the point. Almost $4,000 for the video. Sorry, I'm still on YouTube stuff. Almost $4,000 for the MRI. And to get it for $209.05. I understand there's some people who can't afford that. There's many people who are going through tough times. But if you're constantly billing MRIs at the rate of almost $4,000, think about other procedures that are being billed at these rates. There is no wonder why insurance premiums are going up. And every year that insurance companies make it harder to do business with them, jumping through administrative hoops, jumping through the pricing structures that they have, make it more complex to get things approved, it's only going to make insurance submissions and claims go up even higher, which is why premiums go skyrocketing. This video was made a week ago. In 2025, you can get an MRI with no contrast for $200. Just pay it the day of. It's kind of crazy. I want to hear your thoughts. What do you think about this? You're hearing this or seeing this perhaps for the first time. Maybe you're not, but I still want to hear your thoughts. Make sure you're commenting below on this video. If you're watching on X, comment in the X chat and let me know what you think. Right? If you're watching this on YouTube, let me know in the comment section what you think about these wild prices. Let's take a look at another one. We're not done here. This is crazy. We want to like fully understand kind of what we're dealing with here. All right, here we go.
Question. One thing I've learned not taking health insurance.
Okay. It's probably hard for you to see the writing because you're watching on your phone or on your tablet or something. I'm going to read you the question that a person wrote, just so that you have the context when she's answering the question. All right. So the person said, so how much for an advanced test like an MRI, CT, cardiac stress testing, etc., because it shows hospital ER visits aren't discounted, right? So that's the question. Person wants to know how much for an advanced test like MRI, CT, cardiac stress test, because it shows hospital ER visits aren't discounted. That is the question that she's about to answer. Let's take a look. Listen.
For the last 4 years as a doctor is that the only thing you're guaranteed. Great question. One thing I've learned not taking health insurance for the last 4 years as a doctor is that the only thing you're guaranteed having commercial insurance is that you're going to be charged more for things. So what do patients do who don't have insurance, who need these things above? They just pay cash and they get it for cheaper. And their doctor does not have to jump through hoops to try to get it approved, only to have them be charged more than what it costs. For example, if a patient needs an MRI of their spine, normally insurance companies require them to do physical therapy, try medications, and the doctor has to do what is called a prior authorization, pre-certification, or a peer-to-peer. To basically do all these things to get the insurance company to say, okay, we'll let you have this test, but we're going to charge you $1,000 instead of the $280 that it costs cash. So all these things above are actually pretty affordable if you just pay cash for them. And that's why I think that a lot of people are opening their eyes to health insurance being quite a scam, as a matter of fact, and they're opting to just go cash pay and get the discount.
That is wild. I mean, paying $200 for a procedure that is important for diagnostics, and the insurance company requiring the doctor to go through hoops to try to help that patient out is, in my opinion, it's a waste of resources, it's a waste of time. And frankly, it's a waste of money. It's almost anti-business in a lot of senses. But here's the interesting thing. If the doctor understands coming in that they have to jump through hoops and they have to spend hours getting like a test approved, that's a complex test, a CT, MRI, CAT scan, whatever. Don't you think that they're probably charging more for their time being involved with that one patient themselves because that patient requires more time? So they're probably also billing their time at the insurance rate even higher than that, right? And if their extra time gets declined by the health insurance company, then they're going to be less likely to take patients who are in need of the care that they're billing for. And so specifically in this case, when you're asking for the cash price for these tests, what you're going to see is dramatically a decrease in what it cost for the delivery of the service because there's less hoopla involved in getting the actual specific test. Let me know your thoughts about that. All right, let's go to the next one. Now, this is something that happens to millions and millions and millions of women every day. This is about pregnancy. This is pregnancy self-pay pricing. Like when a woman's having a baby, like this is what this is.
Ashley Hendry, I was calling to get a quote for a self-pay patient to see what the global vaginal delivery fee would be.
If they're self-pay, they give them a package price, which would include the delivery and all of the services that they might need during the 9-month period.
You could give me the global, like the package price.
$5,730.37, and this is for a routine vaginal delivery with pre and post care in the hospital.
Okay, so does that cover like the hospital facility fee, or is that just the OBGYN group fee?
It is both. It includes all of it. And this
I'm sorry, man. I got to cut this off. That's crazy. I'll go back to the video in a minute. $5,000. And yeah, it's expensive. And I'm sure they have payment plans, but $5,000, hospital stay, pre and post delivery, everything that's included to go from being pregnant, all the care visits, the delivery of the baby, anything that happens after the delivery, all that stuff for $5,000. Now, in your mind, here's what I want you to do. How much do you think that the insurance company is being charged for that span of time? All the pre-care to the post-care and everything in between, including the hospital stay. How much do you think is being billed to the insurance company? If it's $5,000 cash pay for the entire thing, and we already seen the price on like just an MRI, how much do you think that is being billed to the insurance company? Let's continue.
is the self-pay package price discounted rate as of today's date.
What about an epidural? Do you have any idea what that is?
It doesn't separate it out. So it's in, I just can tell you that it is included.
The epidural's
And how much of a discount is that from the normal price?
That is the normal price. Ashley gives all self-pay patients that rate.
Oh, okay. Okay.
If you mean a normal price, it would depend on the insurance.
Oh,
So
okay.
that is what any patient who doesn't have insurance would pay.
Okay. Is the insurance price usually more?
It depends on the insurance.
Do you know if they need to pay that full amount like at the time of the delivery, or can they put that on a payment plan?
So they would be able to put it on a payment plan, and this is an estimate for cesarean delivery with 72 hours, $7,574.79, and that's as of today's date.
Okay, and that also includes hospital fee, you know, everything, just a bulk package price.
Yes.
So for a self-pay vaginal delivery is $2,760, and they get a 20% discount off of that.
Does that include anesthesia or facility fees, or is that just like the global pregnancy package?
That is just for the global pregnancy package. The hospital is separate. There's usually another coder with me, but she just quit.
Oh no. And then as far as the vaginal delivery fee, does that need to be paid up front as well, or can they do that as a payment plan?
They can do that as a payment plan.
And what about for the cesarean section?
That one is $3,103, and you also get a 20% discount with that.
And is the 20% discount, is that just for self-pay, or is that for paying in full?
That is just for self-pay.
Okay. Okay. So the higher number is what is the like charged if they have insurance?
If you have insurance and everything, it just depends what insurance you have.
And then do you have a ball?
Interesting, right? Even from insurance carrier to insurance carrier, your price can go up wildly different, right? So if this is kind of boggling your mind, if this is the first time you heard this, or if you're just like, figures, I knew something like this, whatever the case is, you're seeing some wild stuff right here. Wild stuff. Let's finish this up.
Ballpark about how much each prenatal care visit costs just to see the doctor without any testing?
And they also get 20%. If they're self-paid, they automatically get 20% off of everything.
Okay, I'm just calling around today to get some quotes because a lot of people are losing their insurance in January. And I have a cash pay clinic in Hattiesburg and Petal, so I appreciate you giving me some of those numbers.
Yes, ma'am, you're welcome.
How much is the epidural usually cash?
$1,071 after the self-pay discount.
Okay, how much is the self-pay discount?
Before is $1,500.
$1,500, okay. How much is the circumcision cash?
$600, and after the discount, it's
$250.
Yes.
What about like an uncomplicated vaginal delivery?
The total is $5,840, and then with the self-pay discount is $2,244.
Okay.
Craziness.
And does that include any of the hospital fees, or is that just purely the delivery itself?
No, ma'am, that's just for the doctor fees here.
Then what's your price for the self-pay C-section?
Okay, before the discount is $6,450, and then with the discount is $2,440.
These people knock $4,500 off the C-section delivery.
And then how do you guys do billing for all of the office visits for self-pay patients when they're pregnant?
They are set up on our arrangements with the delivery. All lab work and ultrasounds are billed out separately.
Do you have like a ballpark for what like a normal OB visit costs cash?
For like our ICV, it would be $190, and that's not including the ultrasound. It'd probably be $289 without ultrasound.
So $289 with ultrasound?
Yes, ma'am.
And that's the initial prenatal visit? Okay.
Yes, ma'am.
Well, awesome. Thank you so much. I appreciate it.
No problem. You're welcome.
It's Dr. Ashley Hendry. I was calling to get a quote for a self-pay.
So once again, another example of how people are essentially paying out the nose for insurance. And I wonder if do people know they're paying out the nose and they just don't care, or is it that they just don't know that these options are available and therefore they don't take advantage of it? I would have to think that is probably the second, right? Like they know it's something that is that they know kind of how, or they feel how they're getting screwed by insurance, but they don't know exactly the nuances behind it or what they can do on their standpoint. So I wanted to, before I end, I want to just let you know about like another option of kind of what's coming down some of the innovative stuff that's happening with people trying to reduce healthcare. And now there's something out there that I kind of came across called HealthShare. And HealthShare is this interesting kind of business model where these companies set up nonprofits. And what they do is it's exactly kind of what the name implies, that they share the cost of healthcare. And where everyone is a contributor to essentially like a big bucket of membership dues. And those membership dues are then paid out as an aggregate, as a shared cost for when a person has a medical event that needs to be covered. And so there are some stipulations and some guidelines to joining the HealthShare, like a HealthShare company. However, the HealthShare costs are significantly lower than the premiums that one might pay in their own right, having insurance. So here's what I wanted to show you one of the options available. This is not an endorsement of this company. I don't know them. This is something how I just found that I wanted to talk about today. You should do your own research on if this is something that is right for you. But I wanted to kind of just share options with you so that you can decide what tactic is best for you or your family or your wallet. Okay. So let me open up this. Here it is. So here's a HealthShare option. I hope you can see it. Let me try to see if I can make it bigger. One second. There we go. Slightly bigger. Okay. So this HealthShare company is called Crowd Health, right? And it's essentially like as a crowdfunding platform for healthcare cost. So they have what they call a monthly advocacy fee of $55, which is a per member fee to access advocacy tools and support in managing healthcare costs. So essentially what this is and how the company explains it is that when a bill is generated after a service comes up, they advocate on behalf of the members of this HealthShare company to bring down the cost of that procedure. So they give an example on the website of, let's say there's a $500,000 procedure that gets billed to the patient. They come in together, like all together, like they're advocates, and then they negotiate that price from $500,000 to $150,000, saying, "Hey, listen, we're going to pay in cash. We want a cash discount. Perhaps they leverage the membership base. We have more people to send you, and we could pay this off fast." But instead of paying the $500,000, they pay $150,000, right? And then that $150,000 gets split between the membership, right, that have contributed their membership cost to the crowdsourcing, and then that specific procedure ends up costing like $120 per person, as opposed to one person $500,000 going through insurance or $150,000 cash negotiated price on their own. Would you say that's significant savings? I would definitely say it was. That for the cost of your contribution, like you can be paying X amount. So with that knowledge in mind, let me go back to sharing their offerings. Okay, so that's the $55 advocacy fee. They have their maximum monthly crowdfunding ask is broken down here. So if you're under 55, it is $140 a month. If you are over 55, it is $280 a month. Plus, I'm assuming the $55. So like all in, you're looking at $335 a month. A month, less than $100 a week. Family of 4 plus, it's $420 a month. Now, I know what you're thinking. What is my max? What is my deductible? Do they have deductibles, out-of-pocket expenses, et cetera, et cetera? Now, they have two different plans here, right? This one, of course, is Black Swan. This is the original plan. But here is what they have. It says that the member commitment is the amount you pay per health event before we ask the crowd to fund the rest of eligible expenses. So in this case, you pay $500 per event. If you have a pregnancy, you would pay $3,000 for a pregnancy. But remember, an alternative option for this, if you live in an area where they can deliver the pregnancy cost more cheaply than this $3,000, you can just go and do a direct cash pay price for that, right? If that's something that you want to do, you would call up, get a self-pay price, maybe get a payment plan with the hospital, and then you're paying significantly less. All right. In this case, this Black Swan, I don't know exactly what's considered Black Swan. And perhaps I need to read more about the specific. Oh, okay. Well, we can read that, but it's $40. So it looks like your monthly payment is cheaper. They give you like, your out-of-pocket per month is cheaper than the other plan significantly by at least it looks like half or a little bit more, but your per health event costs go up to about $15,000 per health event, and pregnancies are not eligible. So So that you could pay this if you wanted to pay less monthly. I mean, if it was me, it'd probably be in this bucket. This is kind of what I would want. So this covers, the membership covers the crowd-funded eligible medical bills. Let's stick with this one over here, the original, right? Because I think this seems like the better offer. Bill negotiation, they'll negotiate your bills for you. Personal care advocate, you find you a doctor, you get prescription discounts, annual wellness visit, maternity support, unlimited virtual care, unlimited virtual talk therapy, unlimited. Oh, by the way, unlimited. Just thought I would mention that twice. Quarterly specials. And then they have some other discount programs that you can have it. So do you want to know what eligible bills are? Let's see if I can find that. Maybe they have. So here's the example I gave you earlier. It says, imagine a $500,000 bill, hospital bill from an emergency, open heart surgery. The bill first gets negotiated down to a reasonable fair market rate, approximately $150,000, and then gets submitted to the crowd. 1,111 members give $140 each to meet the need of this medical bill. Wild stuff. This is super interesting. And then under their FAQs, let's see if we can handle. Okay. So how do you handle previously diagnosed or documented health conditions? It says for previously diagnosed or documented health conditions, no costs associated with the condition are eligible for crowdfunding in the first or second year. Starting in the third year of membership, up to $25,000 to bills per year related to previously diagnosed or documented health conditions may be submitted for crowdfunding. So there is a limitation. There are some limitations, right? You have to wait 3 years to get some of them covered, some of the costs covered. Assuming that you maintain your membership for 3 years, they will cover up to $25,000 a year in your pre-existing medical condition cost, right? They say that for big healthcare events, like if you know you have something coming up, it says that members' eligible bills can be funded each month. For big planned bills, like expensive surgeries, they'll negotiate the cost to a 30 to 60% discount before the procedure event happens. For big emergency bills, they'll work with partners to negotiate them after the fact. There's no maximum amount of healthcare costs you can share with the community. So there is no cap on the cost that you can share. And then they have in some restrictions on what's not eligible for funding. So it says that examples of procedures and treatments not eligible for funding include cosmetic, long-term prescriptions, fertility or infertility treatments. Procedures and treatments tied to a pre-existing condition are not eligible for funding in the first and second years of your membership, and funding is limited in subsequent years. And then there's some other stuff there too. So the goal here is to get in to this program when you are relatively healthy. If you are relatively healthy, like, you know, just like anything in life, pre-planning is going to work in your favor before you have, you know, some conditions. It says, do you count as health insurance for states that have an individual mandate? And I'm in a state that does, Massachusetts. It says, no, your crowd health membership does not satisfy a federal or state individual minimum essential coverage mandate. If you live in a state, California, District of Columbia, Massachusetts, New Jersey, Rhode Island, Vermont, with a state level individual MEC mandate, you are responsible for securing that coverage independently from your crowd health membership. So that's separate. So here's another one. One annual wellness visit per event per member per year, costing up to $300 is eligible for crowdfunding without the initial $500 member commitment. Eligible wellness events include primary care wellness exams, neuropathy, including neuropathy, pediatric well child visits, direct primary care membership fee, annual female gynecological exam and labs, dental exam, including cleaning and x-rays or vision exams. So they'll give you, one of those a year, costing up to $300 without having to pay that $500, which is actually pretty cool. So I did want to address prescriptions because they do have prescriptions on here. It says prescriptions related to a specific health event that occurs while you are a member are eligible for funding by the community for up to 12 consecutive months. Prescriptions lasting longer than 12 months are not eligible for crowdfunding, but regardless of the timeline, you have access to our primary discount partner, which can reduce your prescription costs by 50 to 60%. So again, with more savings. So from my opinion, these are just options that are on the marketplace. In our lives, we need to kind of like take control over the cost. And these are just some ways I wanted to explore with you today on how you can lower healthcare costs. And as you see, there's doctors on board who are geared towards doing this. I think I'm going to do another show on boutique doctor practices. But if you have an interesting topic that you want me to explore the business side of, maybe you want me to do another one on health insurance, leave your comment in the comment section. Leave it in the comment section under this video. And I appreciate you watching today. Remember, if you don't go about doing your business, you're going to be doing the business of someone else. I'm Micah. And until next time, I am